Hey, what's up? It's your boy, Coach K, back at it again. And in this video, we're going to be taking a look at cardiac conditions. If you're a PT student or new grad and you're looking for more questions just like this, go ahead, like this video, subscribe to the channel. Let's get it. So we have Blake as a 45-year-old male patient with chest pain at rest, pallor, palpitations, hypertension, and an elevated blood serum cholesterol level of 242 milligrams per deciliter. Stop. A lot of information in this first sentence. So we got a 45-year-old male, okay? Chest pain at rest. That's very important. This is also known as angina. The chest pain part is known as angina. They have pallor, palpitations, hypertension, and we know that their cholesterol level is high. Okay. Now it says all of these clinical signs and symptoms are most likely red flags indicative of which of the following conditions. So we're really looking at these signs and symptoms right here, these findings, and we're thinking of which of the following conditions listed here is most likely going to show up with these things. All right. So let's go down to the comment box right now. Put down what is your answer. What do you got? All right. Be confident about this. And let's knock it down together. We got A, stable angina pectoris. All right, for those of you who are unfamiliar with this, you may see that term stable angina pop up in notes or even on the NPTE. That's where a person has chest pain that is due to some type of exertion. All right, they get on a treadmill, start running, whatever it is, and they develop chest pain. It's typically due to ischemia or ischemic pain. Again, keyword here is exertion. If I look up at the question, stable angina doesn't really make a lot of sense because it says that the patient has chest pain or angina at rest, not just with exertion or anything like that, at rest. Well, stable angina is with exertion, so I'm going to go ahead and get rid of that. Now, some of those other things can set a patient up for stable angina pectoris. You know, the palpitations, the hypertension, and all of that could be present in a patient with stable angina. But again, chest pain at rest is not consistent. Let's take a look at unstable angina. Now, let me tell you a little bit about this. There are things like high cholesterol, coronary artery disease, hypertension, all of these things that can set a patient up for unstable angina. This is where the person has chest pain at rest. All right, this is a progressed condition here. This is something that is not necessarily a great condition to have because it is where the heart is really not functioning properly, not able to get the blood flow that it needs. And so the person has chest pain at rest. Is unstable angina pectoris associated with the signs and symptoms in the question? I would say yes. Yes, because remember, not really good blood flow, right? And so pallor is consistent, palpitations, hypertension, and even that elevated cholesterol level is consistent. So I'm like, bam, I really like unstable angina as the final answer here. But hold on a minute. We're not done yet. Let's take a look at C. Pericarditis. Again, as I'm looking at this one, the chest pain at rest, the pallor, the palpitations, the hypertension, all of these things combined don't really ring a bell for pericarditis. They're not red flags for pericarditis, which can be that inflammation of the outer ring of the heart, you know, the outer layer of the heart. So here I'm not really seeing a huge association with all the signs and symptoms in the question. Therefore, I'm going ahead and Xing out this condition right here. Let's take a look at D. D says peptic ulcer. Some of y'all selected this one. But again, remember the question's asking about the signs and symptoms here and which of the conditions is it's most likely a red flag or these red flags for. And so as I'm looking at it, peptic ulcer, yeah, that can produce chest pain. But when we're thinking about it, does it come along with pallor? Does it come along with palpitations? Does it come along with hypertension necessarily or even elevated cholesterol? I'm like, no, not necessarily. And so we're going to go ahead and put an X next to D because really, if I look at it, B is the one that has The vast majority of these signs and symptoms, but most of all, when I see these signs and symptoms and I see them as a bunch, these are major red flags for unstable angina pectoris. This is one of the types of questions that you can easily get on the NPTE. So it's important that you know these conditions, but also the signs and symptoms that are associated with it. Again, congratulations to those of you who got this one correct. If you struggle with questions just like this, I want to invite you over to my free private Facebook group where I help students learn how to crush questions like this, get a 600 or higher, and move on to their dream job. All right. Where can you go? www.nptegroup.com right now if you want to get a 600 or higher. I'll see you in the next episode. Have a good one.